Hey Bernie, Tim Handren, your mayor here. Today is Tuesday, September 15th, and I wanted to give you an update specifically on COVID-19 in our community. Over this past week, there's been a lot of energy online expressed about masks. People are tired of wearing the masks, and we've seen a local county, west of here, Bandera County, who has filed for mask exemption. And there's a big question about why don't we do that in Boerne. I'm not going to answer that today, but what I want to do is just provide a little bit of context because I think it's important that we understand the contextual framework that we operate in. Last night, Judge Lux and I and Jeff Fink, our county EOC coordinator, and Steve Perez, the city's EOC coordinator, we had a meeting with our local DSHS, that's Department of State Health Services, doctor and officials. We met for about an hour just to go through all the numbers as we get them every single day. Again, Jeff Fink is doing a great job in keeping our county completely informed on what's going on. And as we went through those numbers, we just wanted to verify that we understood the way it's presented. And if you don't know how to access those numbers on Facebook, you can get those on the County Emergency Management website. But I want you to understand the process that DSHS uses. That's probably the most important thing. Dr. Ringsdorf is who we spent some time with last night, and Sammy Sykes. Those are the two folks we rely on for our numbers in Kendall County. And they talked about the process that they follow. So let me just go through that real quick. When somebody goes and gets tested for COVID-19, whether that's at a clinic or their doctor or some of the drive-up testing that we do, not only in Kendall County, but even Bexar County, and somebody tests positive in that testing process, that is reported to the state. What happens at that point is for Kendall County, we rely on the state to go through contact tracing. What the state does is they look at what kind of test was it. There's two basic tests. There's one called a PCR and one called antigen. The antigen is the rapid test where you can get your answers in just 20 or 30 minutes. The PCR test, it might take 24 to 48 hours. The efficacy of those two tests are different. And so if it's an antigen test, they don't actually do the contact tracing. That's what they told us last night. They're just going to list that on their dashboard as a probable case, but they won't spend any time calling people. If it was a PCR test, the state then goes through contact tracing. Over the last month and a half, they have changed that process. They have a third party that does that. That third party attempts to contact the individual that tested positive. Now, it's really important that if you've gone and taken a test that you answer the phone. What they're finding is everybody's not answering the phone, and that's what's causing a challenge in their contact tracing. But when the third party wraps up their contact tracing, they hand it back to the state, and then the state does a verification step. That verification step is basically ensure that the county is correct. Is it in Kendall County or is it in Bexar County or Kerr County? They go through one last step to make sure things are reported correctly. And until that is all completed, they list on the daily information that we get the status of those cases as TBD, to be determined. Now what that means is when you look at those numbers, the TBD, somebody has tested positive in the last 14 days. There's no question about it. And we're going through the whole cycle of contact tracing. Then what they do is they have a time-based methodology, and they say after 14 days, those TBDs are going to fall off. They're going to assume they're recovered. And if they didn't get to finish their full contact tracing and verification, they're going to list those as recovered. So why is that important to understand? A lot of folks are looking at the numbers in Kendall County, and they're focused on that one cell that's called active. And as of last night, we have 6 active cases in Kendall County. Now, you got to look at the other number right next to that, and that says to be determined is 119. So what does that mean? Well, there are 6 that have gone through the entire process I just described, but there were 119 that have tested positive, and they're going through the contact tracing. So we have actually up to 125 active cases in Kendall County at this very moment. That's what the data actually means. So I want you guys out there to understand, I know some of you are going out and you're looking at the Kendall County Emergency Operations website. You're looking at this data daily, and you're focused on that active number, but what you have to look at is the combination of active and to be determined. We asked a lot of different questions of Dr. Ringsdorf last night. She confirmed over and over again, yes, those are folks that tested positive, and we're just going through the cycle of doing our contact tracing. We assume that they are positive until we're told differently. So when I look at the numbers, when Judge Lux look at the numbers, we're looking at the whole context. If you get the Boerne Star, you'll see an article in the paper today about this. Later this week, Judge Lux and I and other local officials are going to meet, and we're going to talk about how we look at these numbers and what they mean. Ultimately, as that article said, this is Judge Lux's decision to either fill out the attestation or not to say that we are a low COVID county. But the way I look at these numbers, we're not low COVID county. We have 125 cases over the last 2 weeks. Now, some of you may not like hearing that. I'm not trying to be trying to sway you in one way or the other. I'm telling you factually how the data is presented to us. And again, this data is received daily. I've looked at the detail. We have there's a case number for every one of these that's been assigned by the Department of State Health Services. And Jeff Fink stays on top of these numbers quite closely, and he does a great job of that. So with that, again, you'll hear more later this week, but I wanted to give you guys that context for the way that Judge Lux and I, as we collaborate on this with all the local officials, what we're looking at. The last thing, just a couple of reminders for you. On the 18th, that's Friday this week, we have drive-up testing for COVID-19 from 8 to 4 at the fairgrounds here in Kendall County. And it is coming into flu season. A lot of folks are talking about that in consultation with all the doctors. Dr. Fowler, Dr. Ben Stahl, all of our doctors in our doctor resource pool, they all recommend go get the flu shot as soon as you can for this year, just to lower the risk of any other diseases you might contract. That's all for now. Boerne, bring you more updates as soon as we have more to give you. Thanks.